Hi, I'm Dr. Gurung. I'm one of the ST trainee currently working in Northwest Deanery. I'm aware a lot of the people are giving mrpsych exam this week as well as the following week. So today I'm just generally talking about the mindset before giving exam. Okay, a lot of the people, when I have discussed with a lot of the people, they say that when they appear for an exam, one of the things that they struggle is confidence and how to control the anxiety. Okay, so I'm making this video and I love telling story. Okay, for example, imagine that I'm just imagining that my exam is tomorrow. Okay, so before giving an exam, it's normal for me to feel anxious, and people who are watching this video can also relate their experience that okay, they might feel that I've not prepared enough. They might have a feeling that okay, I need to do more which I have not done. What if the stations that come in the exam where I'm not prepared? So it's a normal kind of feeling or experience to have this before giving exam. Now let us for example, if I have a MSI class exam tomorrow, okay, how to deal with this kind of conundrum, or this kind of thing before giving exam. So the mindset that I need to have before appearing is, number one, I need to calm myself by saying that I've done all the hard work that I need to do. Okay, this is not a time to prepare again. You need to be confident. In order to be confident, you need to know your strength as well as your weakness. Okay, the thing is now, okay, what you can do before giving exam. And I would advise that people who are giving MR Psych course exam next week, just to practice this, which might be helpful for you to relieve your anxiety. Okay, so the thing I did was to be confident. Affirmation is very important. Okay, I used to say to myself that I'm a bit of like narcissistic kind of character, thing I used to do. I used to say that I'm one of the best doctor. If any patient that I'm seeing, I'm going to provide the best care I can. Okay, when you say a lot, you tend to believe. Okay, that also helps while giving exam. Number one. Okay, so the thing that I used to practice as, before going to sleep, I used to say the same phrase looking at the mirror as if I'm telling to myself. Okay, and the first thing when I used to wake up, I used to say the same thing, that okay, you are one of the best doctor. You are able to provide the best care for the patient. I'm going to treat this patient as if this patient is my family member. By doing that, you become, I got a sense of like confident, and it also helps to be yourself. Okay, so this is a general tip. The number one tip give I can give to anyone who is appearing for this exam. Okay, just to be confident. In order to feel confident, you have to use affirmation. Okay, just try to be away from negative influence of people who says that this exam is difficult, or they try to just try to be away from this environment. Number one. Okay, now number two, let us talk about the mindset. Especially like before giving exam, make sure you have got plenty of rest, at least like 7 or 8 hours. I know that a lot of the people do struggle with the anxiety, and they might only have like 3 or 4 hours before the exam. The thing that you can do to relax your mind is, there are a lot of hypnosis kind of videos, as well as the music which helps to calm you before an exam. So if you're anxious, make sure that you listen to music. There's also an app called Headspace where you can listen to calm yourself. Drink plenty of water. Okay, before going to bed, you can have hot milk or take a shower, which might help you to relax. Now the mindset in an exam. Okay, when you are going for an exam, now I'm aware that the exam, they do the online kind of thing. It's not like the exam that I appeared, where you have to go to Sheffield. It's a big hall. That is not the case now. Okay, so then now the mindset needs to be read the question. Okay, in the morning time you will have 90 seconds. One of the things is whatever is given in the task, okay, take that while you do your consultation in the exam. Okay, and the other important thing is, for example, in the task it is said, okay, you are seeing the patient in A&E, you are seeing a patient in A&E. If in the task it says that you are seeing a patient in home, you are seeing a patient in home. Okay, so that needs to be mindset. When you feel it, then it becomes easier for you to empathize, as well as so sympathy, and it also helps you in your communication. Okay, so that is a mindset. So we have talked about two things: how to be confident. Second thing is how to be you bit about mindset. Okay, so generally today I'm just talk about two things. Okay, to be confident and to control your mindset. Okay, now coming to a few of the things which might be helpful for people. Okay, like if you're doing any station which is an angry station, okay, make sure you give plenty of time for a patient, a family to vent their anger. But having said that, be mindful that this station is only like 7 minutes. Okay, let us take an example of a station where angry mother comes and close up in topic, and they want to take son home. So in this kind, a lot of the trainees fail the station because and they try to defend. Okay, imagine there's a two line. This is you and this is the patient. Okay, what happens, for example, every time when the mother says that okay, you are not doing your job, and you try to defend by saying that okay, we are doing the best job, okay, I'm going to provide you information of close up in. So every time what happens is, imagine if this is the thing, mother says something, you say something, and you go in this way. Okay, so the general approach in this station needs to be, we are on the same team, and the team that we are working for is your son. So example, if in this kind of station, if the mother says, I'm not happy, I want to take home. So your normal response should be, it would be helpful if you can say that, okay, I can clearly see that you are concerned about our son. Okay, I've heard your concern, so let us see what we can do for your son. By doing that, what happens is you two are agreeing on the same agenda, and it helps to move ahead in the same direction. Okay, so clear. So I've just given you an example of a general tip. If it is an angry station, okay, make yourself calm. Okay, and give plenty of time for someone to vent their frustration or anger, but be mindful, 2 to 3 minutes, and after that you need to proceed with the task which is given to you. The other thing is in the task, okay, if it is given, take a history, just try to stick with the history format. If you're taking like a general history, just think as a junior doctor when you are clocking a patient: present history, past history, medical history, forensic history, social history. By doing all of this, the risk needs to be there. Risk to self, others, as well as explore the other like drugs, alcohol, psychosis, depression. Clear? Okay, so when you're taking history, remember it's a history station. Okay, and you also need to have differential diagnosis. When you are doing when the task is a mental state examination, just stick with the format of a mental state examination. That is appearance, behavior, speech, mood, thought, perception, cognition, insight, and risk. Okay, when it is a mental state examination, please be mindful, don't try to do a history station. Okay, when you are doing a mental state examination, you need to explore more about psychopathology. Okay, for example, if it is to explore psychosis, okay, if you're exploring psychosis, you need to go with divide it into two parts: thought and perception. If it is a thought, okay, you need to explore the delusion, whether it's a primary, secondary delusion. In delusion, three things: what it is, how they came to the conclusion, and check how much they believe, how firmly they believe. Three things. Be mindful, there might not be just one delusion, there might be a number of delusion. So make sure you explore all the delusion. Clear? Primary, secondary. Primary is it came all of bloom. Secondary is if someone has got mental illness before, or and it's a manifestation of that is a secondary delusion. Okay, in delusion also there are a number of delusion. There could be persecutory delusion, people following them, plotting against them, reference. Okay, reference can be from where they are getting the message. Okay, so let us take an example of someone who believe the bottle. They go to the GP, and in the bottle there is written 666. So they might be. So in this case, you have to explore how they came to the conclusion, what it is, how they came to the conclusion, how they form they believe, and explore other delusions. Okay, for example, if it is in this kind of scenario, the person might say, okay, I've got a chip inside my head. Don't go with the approach that, okay, you have got a chip inside your head. Do you have got thought incineration withdrawal broadcasting? Just try to go with the flow of the patient. For example, if the patient says, I've got a chip inside my head, just say, okay, do other people know that you have got a chip inside your head? Okay, so that needs to be approached. Use the same theme that the patient has given you. So clear with the thought. When you're exploring perception, you need to be very clear how you ask question. Like visual hallucination. Do you see things when there's no one around? Okay, not just like, do you see things? So it needs to be very specific. And if you're exploring hallucination, try to explore the five hallucination: visual, auditory, gustation, tactile, and olfactory. Make sure that you do all the things. Clear? Okay. The other bit I want to talk about is financial capacity. This is a station that most of the doctors who are appearing for the cars, they do struggle. So if you are doing a station on financial capacity, the task is, I'm just giving you a common scenario that usually come in an mrpsych exam, where a guy have been moved to the new place. Before that, mother used to sort out all of his financial problem, but since moving over there, he's struggling to pay his rent. This guy has got a history of paranoid schizophrenia before, is on risperidone. He's also hoarding. He's angry that he has been moved in the place, and he wants an apology letter from the council before. Then only he's going to pay the rent. The task is to do our financial capacity. So in this, you have got 7 minutes. So the things like doing a station like this, or any of the station in the cars, always remember the three things you have to be mindful of: range, depth, and on side by side, the communication needs to be there. When I say range, imagine there are a number of balloons. Okay, so your range is just picking up the balloon. Okay, depth is going in depth. Okay, explore what kind of balloon is there, how big is the balloon, what is inside the balloon. So that depth is, you have to define more. And communication is, it should not be a thing that you are just ticking in the box. um, Remember, there's a person on the opposite side. Okay, don't assume the other side is just a robot and you keep on asking the question and they're just going to give you um, the things that you need. Okay, so that should not be the thing. You have to treat the other anyone, your patient, as a normal human being. Okay, so that is the approach. So let us quickly talk about the financial capacity. So in financial capacity, um, 7 minutes, 2 minutes focus on doing the mental state examination. The mnemonic I had for this station was, Michael, you are Winston Churchill. That means Michael is quick mental state examination. Keep in mind the task is financial capacity. But if you look at the mental capacity, first and foremost, you have to exclude whether the mental and the physical health is impacting someone's ability to make a financial capacity. So the quick 2 minutes, you have to explore and rule out. For example, in this case, patient has got paranoid schizophrenia. So make sure that patient is taking medication Check, the mental state is stable, like no more hallucination, no more kind of abnormal thought disorder. Okay, check quickly on drugs, alcohol. So just focus on 2 minutes on that. So the full form of Michael, you are Winston Churchill, Michael, mental state examination. Now the four things: understand, retain, weigh up, and communicate. Okay, before we go to the four things, also make sure that they have given a clue of hoarding. So explore whether the hoarding is impacting their ability to make. So check that. Okay, the third thing which is given over there is he wants an apology letter from the council. So make sure that it's not a part of a delusion. Okay, so I know it's a difficult task, but 2 minutes, focus on that. Okay, so now coming to the four things that you have to do: understand. Okay, just check how much money they are getting, the source of the money, how much expenditure they are having. Okay, so this all comes in understanding. In understanding, you can go more depth by asking, whether they are able to recognize the money, whether they are able to do the general subtraction, addition. Okay, whether they are know where the money comes. Okay, do they know about saving? Okay, so all of these things, it comes in understanding. After understanding, to check the written, you can basically ask the patient to summarize the things that we have discussed. Number one, understand, retain. So we have done two things. Now the third thing is weigh up. Okay, so you have to go in two sides. Do they understand the advantage as well as the disadvantage? This can be only done if the patient have retained. So most of the doctors who give this exam, they forget to check the retain. Okay, so make sure you check the retain. And when they do the weigh up, the last bit is communication. So imagine that I've done the station. So at the end of 6 minutes, if I have got 1 minute, the thing that I would generally, end the station is by saying, let us say, patient name is Michael. Okay, so I would say, Michael, from a discussion that we have, um, the things I have checked is I have quickly checked your mental state examination. That means just to make sure that how is your mental health. From my assessment today, I found that you're taking your medication, you're not experiencing any psychotic symptoms that you used to have in the past, so it's stable enough. Okay, I've also checked your hoarding, which has been like collecting rubbish, which has been for a long time, and it seems like this is not impacting your ability to make a decision on money to pay the rent. Okay, and I also understand that you want apology letter from the council because you're a bit angry. They give you a place that you didn't want, and you also have got some concern with um, the children throwing rocks. So finished. Okay, then I would summarize that we have discussed a lot about your source of income, your outcome, where you do. So you understand everything. I give you a bit of time. You're able to retain. Then we discuss about um, advantage as well as disadvantage. And you said that the last bit, when I asked you, what you want next to happen, you said that you want an apology letter, then you will only pay, but you understand everything, you're able to retain, you're able to weigh up. From my assessment, I can clearly see that you have got financial capacity. But in some cases, I would also go further by saying people do struggle with finance and paying rent. Okay, if you want, what we can do is we can provide support. The support can be from your care coordinator or a citizen bureau. So this is the way I would normally end the station. Okay, so in summary, before I end this um, video, the summary, the things that we discussed today is some general tips for mrpsych exam. Okay, so the last, and I just remember, let me also quickly talk about some station. Okay, some station, for example, someone, it might be a risk assessment station where someone wants to hang themselves. So let us imagine that you have done the station and you are almost like 6 minutes. And even in the 6 minute, if the patient says, okay doctor, I want to go home, And from your assessment, you have identified there's a high risk of suicide. Okay, so in this station, you can say that, let us say a patient named John. So you can say that, okay, John, I'm really worried about you, and I've got a big concern about you. And even if they say I want to go home, you can say that, John, I'm afraid that we have offered you a home-based treatment team, and it seems like you clearly see that said that you didn't want to engage with a home-based treatment team, and I also identified there's a high risk. John, what do you say if I offer you to come to the hospital? By that you are doing giving an option for a patient to come. But even after that, if they say that I want to go home, and if you have identified an element of mental illness, you can even say that, I'm afraid, John, okay, in that case, I have to request for a Mental Health Act. The two doctors who are experienced enough and an AMP will see. Those two doctors will be a Section 12. That means that they have got a lot of experience in dealing with mental illness, and will take it from there. So, this is the normal thing, that this is the normal approach that needs to be before ending a station. It doesn't look nice if you say that, like in this kind of scenario, you said that, oh, I'm afraid I need to call my senior. By doing that, it shows that you're not able, you're not at the level of passing a casc. Okay, so thank you very much. I've talked a lot. Okay, and I hope people who are giving casc this week and next week might find the topics that I'll discuss might be helpful for them. Okay, all the best for exam. So the general take home from this video is, be confident. Okay, in order to be confident, you need to know your stuff. You have got 16 station, you only need to pass 12 station. Okay, and there might be some station where you might struggle, but imagine that you have got now 16 patient. You open the door. If the door doesn't go well, just close it. Okay, you only need 12 station to pass an average. Give your best, be confident, and thank you very much. Bye.